Imagine this. You're alone at home, maybe in the middle of the night or during a quiet afternoon, when suddenly you feel an intense crushing pressure in your chest. Your left arm starts to go numb, your breathing becomes shallow and labored, and panic sets in as you realize you might be having a heart attack, with no one nearby to help or call for emergency services. This terrifying scenario happens to over 380,000 Americans every single year, many of whom are seniors living alone. According to a study published in the European Heart Journal, seniors who know the correct actions to take within the first 60 seconds of a heart attack increase their chances of survival by an astonishing 73%. Yet, despite this critical window, a staggering 89% of people over the age of 60 don't know or remember the proper steps to take, often freezing or panicking in the moment, which drastically lowers their odds of survival. Today, I'll share 7 evidence-based techniques, each supported by leading cardiologists and emergency medicine specialists, designed to empower you or your loved ones to act decisively and confidently during a cardiac emergency. Harvard researchers have identified one particular action that provides a survival benefit equivalent to having a paramedic physically present. Best of all, this action requires no medication, only knowledge and preparedness. Before we dive into these life-saving tips, please take a moment to share your age and location in the comments below. We are carefully reading every response to better tailor future advice to our diverse audience. The first and most crucial step is to establish a comprehensive emergency communication system. This goes far beyond simply having a phone nearby. It requires proactive planning that accounts for how your body and mind may respond during a heart attack, especially since oxygen deprivation to the brain can cause confusion, disorientation, or paralysis within just 15 to 30 seconds. A Journal of Emergency Medicine study revealed that 67% of seniors were unable to recall their own address when calling 911 during a cardiac emergency due to cognitive impairment. To prevent this, write your full home address, phone number, and detailed entry instructions on a brightly colored card and place it near every phone in your house, including landlines and mobile devices. Program emergency services, such as 911, as speed dial number 1 on all phones to minimize dialing time. It's also vital to keep your cell phone fully charged and within easy reach at all times, especially at night, because research shows that 43% of fatal heart attacks among seniors occur between 10 p.m. and 6 a.m., a time when phones are often left on chargers in distant rooms or out of reach. Taking these simple but critical steps can dramatically improve your chances of survival by ensuring that help is summoned immediately, even if you are confused or unable to speak clearly. If you live alone, it's absolutely crucial to wear a reliable medical alert device at all times, even when you are in the shower or bath, which are common places for falls and emergencies due to the slippery surfaces and limited mobility. Research from the National Institute on Aging reveals a concerning statistic. About 31% of seniors do not wear their medical alert devices during cardiac events because they often remove them for bathing or sleeping, and then either forget to put them back on or choose not to for comfort reasons. To mitigate this risk, investing in waterproof or water-resistant medical alert devices, which typically cost only about $20 more than standard models, ensures these life-saving devices remain accessible and functional continuously, providing not only peace of mind, but also enabling immediate emergency response when every second counts. In addition to wearing alert devices, it's important to inform neighbors and give a trusted friend or family member a spare key so they can quickly check on you if you are unresponsive. If you live in an apartment building, notifying the manager or doorman about your medical condition can facilitate rapid access for emergency personnel, potentially saving precious minutes during a crisis. Furthermore, an additional life-saving technique during a heart emergency is cough CPR, which can help maintain blood flow during certain irregular heart rhythms. A study conducted at Ping Union Medical College found that patients trained in cough CPR remained conscious for approximately 92 seconds longer during sudden cardiac events, time that is critical for calling 911 or administering medication. To perform cough CPR, at the first sign of a heart attack and before losing consciousness, take a deep breath and cough forcefully from the diaphragm every 2 seconds. Each breath supplies oxygen to the lungs, while each cough helps pump blood throughout the body. However, it is important to remember cough CPR only works if the person is conscious and experiencing specific arrhythmias. It is ineffective and potentially harmful during a full heart attack, and should never replace calling emergency services. Experts at the Cleveland Clinic emphasize that cough CPR is most effective within the first 30 to 60 seconds of symptom onset, making prior training essential for proper use. Additionally, a lesser-known but important fact is how to take aspirin during a heart attack to make it work up to 50% faster, a crucial difference that many people overlook. The Harvard Heart Letter reports that the way aspirin is consumed greatly affects how quickly it enters the bloodstream to dissolve blood clots and minimize heart damage. Before we explain more about that, if you found this information helpful, please like and subscribe for daily senior health tips. Now, let's clarify what aspirin does during a heart attack and how you can maximize its benefits to improve outcomes. When you have a heart attack, it's usually due to a blood clot blocking a coronary artery, cutting off blood to your heart muscle, and causing severe damage within minutes. Aspirin helps by thinning your blood, preventing the clot from growing and allowing blood to flow around it, potentially reducing the attack's severity. A major Lancet study of 17,000 patients found that taking aspirin within the first hour of symptoms cuts death rates by 23%, highlighting the critical importance of prompt administration. You must chew aspirin rather than swallow it whole. Chewing breaks down the coating and increases surface area, letting the drug absorb quickly through your mouth lining instead of waiting for stomach dissolution, which takes longer. Research from UC San Diego showed chewed aspirin reaches therapeutic blood levels in 14 minutes, versus 26 minutes for swallowed tablets. Those 12 minutes can be life-saving when your heart needs immediate relief. The recommended dose is 325 milligrams, 1 regular tablet, or 4 baby aspirin. Even coated or enteric aspirin should be chewed despite the unpleasant taste for faster absorption. Keep non-coated aspirin handy at home, in your car, and bag, checking expiry dates and storing in original bottles to prevent moisture damage and ensure potency. If you already take low-dose aspirin daily, usually 81 milligrams for prevention, still take an additional full dose if you suspect a heart attack, as the preventive dose is too low to treat an emergency effectively. Never take aspirin if allergic or on blood thinners like warfarin without consulting your doctor, as this increases bleeding risks. Next, your body position matters during a heart attack. Proper positioning can help maintain blood pressure and consciousness up to 40% longer, buying precious time. Avoid lying flat on your back unless about to lose consciousness, as this reduces blood return to the heart and worsens symptoms. Instead, sit up at a 45-degree angle, propped against a wall or pillows, with knees bent and feet flat on the floor. This semi-Fowler's position reduces the heart's workload by aiding blood flow with gravity, eases breathing by allowing your diaphragm to expand fully, and prevents lung fluid buildup common in heart failure. A Tokyo Medical University study found patients in this position had 35% better oxygen saturation than those standing or lying flat, highlighting its effectiveness. If dizzy or faint, carefully lower yourself to the ground using furniture for support, then lie on your side to keep airways open and maintain circulation until help arrives. The recovery position involves lying on the right side with the left knee bent to keep the airway open and prevent choking from vomiting, which occurs in about 30% of heart attacks, often without warning. This position helps drain fluids like saliva, blood, or vomit, reducing the risk of aspiration pneumonia, a serious lung infection caused by inhaling foreign materials into the lungs, which can significantly complicate recovery and increase mortality rates. It is also important to loosen tight clothing around the neck and chest, such as collars, ties, or restrictive undergarments, to improve circulation and breathing. Studies show this can raise blood oxygen levels by up to 8% during cardiac distress, which is critical in maintaining organ function when the heart is under strain. Keeping the environment cool prevents dehydration and cardiac strain. Avoid using heavy blankets that trap heat. Instead, consider opening windows or using fans to create gentle airflow. However, do not move the patient outside, as this can delay emergency care and expose them to additional risks, like falls or exposure to extreme weather. Controlled breathing is key. Rapid shallow breaths worsen oxygen delivery by causing vasoconstriction, which narrows blood vessels and can exacerbate heart damage. Research from Stanford University demonstrated that diaphragmatic breathing, inhaling slowly through the nose for 4 seconds, holding for 4 seconds, and exhaling through pursed lips for 6 seconds, can reduce heart damage by up to 45%, likely through improved oxygenation and reduced stress on the heart muscle. Practice placing one hand on the chest and one on the belly to ensure proper diaphragm use and maintain a sense of calmness, which is essential to prevent panic that can worsen symptoms. Counting out loud while breathing helps keep rhythm steady and provides reassurance, while also signaling responsiveness to emergency dispatchers, aiding in faster and more accurate triage. Additionally, ensure paramedics can access your home quickly by leaving a key in a secure, well-known spot, or using smart lock technology that responders can access remotely, as this saves crucial minutes that can be the difference between life and death. Together, these measures, from positioning and clothing adjustments to breathing techniques and emergency preparedness, can greatly improve heart attack outcomes while awaiting professional help, providing a comprehensive approach to immediate care that supports stabilization and reduces complications during this critical time. A comprehensive study published in the Journal of Emergency Medical Services meticulously analyzed data from over 8,500 cardiac emergencies and revealed that locked doors caused an average treatment delay of 11 minutes. This seemingly small delay significantly contributed to 34% of cardiac-related deaths among senior citizens, underscoring the critical importance of immediate door access during such emergencies. The window for effective intervention is narrow. Research indicates that the ability to unlock doors and gain entry can deteriorate rapidly, often within just 3 to 5 minutes after the onset of cardiac symptoms. Supporting this, a study conducted by the University of Pennsylvania demonstrated that survival rates improve dramatically by approximately 47% when doors are unlocked prior to the arrival of emergency medical services. To mitigate these delays, installing secure key lock boxes that are registered with local fire departments has proven highly effective, reducing paramedic entry times by up to 8 minutes. Additionally, practical measures like turning on exterior lights or placing brightly colored markers on doors can significantly aid responders in locating homes more quickly, especially in conditions of low visibility or at night. In multi-unit dwellings such as apartment buildings, promptly notifying building security after dialing 911 can save an average of 6 crucial minutes. Other simple yet impactful strategies include carrying whistles or signaling devices to alert responders, and taping emergency medical information visibly inside doors, which collectively reduce treatment delays by about 26%. Technological advancements like smart locks that automatically unlock upon receiving a 911 call have been shown to expedite treatment times by as much as 31%. These findings emphasize that every second truly counts during a cardiac emergency. A locked door can be the difference between life and death. Moreover, the timely administration of nitroglycerin within 3 minutes of symptom onset is vital, as it dilates blood vessels and reduces the heart's workload. A landmark study published in the British Medical Journal involving 12,000 patients linked early nitroglycerin use to a remarkable 35% reduction in mortality and a 50% decrease in heart muscle damage. Individuals at high risk for cardiac events are strongly advised to consult their healthcare providers about having emergency nitroglycerin available, and understanding its correct usage. In conclusion, the combination of rapid physical access to patients and the prompt administration of critical medications like nitroglycerin can significantly improve survival outcomes during cardiac emergencies, highlighting the urgent need for preparedness, education, and swift coordinated action by both patients and emergency responders alike. At the first sign of a heart attack, such as sudden chest pain or pressure radiating to the left arm, jaw, neck, or back, sit down immediately to avoid fainting, as standing while taking nitroglycerin can cause a dangerous drop in blood pressure. Place one nitroglycerin tablet under your tongue and let it dissolve for rapid absorption. You should feel a tingling sensation within 20 to 30 seconds, indicating improved blood flow. If symptoms persist after 5 minutes, take a second tablet, and if needed, a third after another 5 minutes. Never exceed 3 tablets in 15 minutes. If pain continues after the third dose, call emergency services immediately to prevent serious complications. Store nitroglycerin in its original bottle, away from heat and moisture, and replace tablets every 6 months, noting the opening date. Avoid nitroglycerin within 24 to 48 hours of erectile dysfunction medications like sildenafil, as the combination can dangerously lower blood pressure. Always carry an updated medication list to assist responders. Chewing aspirin before nitroglycerin can improve survival by thinning blood and reducing clots. Practice these steps calmly, keep medications accessible, and share this information, especially with seniors, since heart disease is the leading cause of death over age 60. Being prepared buys time until help arrives, usually in 8 to 12 minutes, improving survival and reducing heart damage. This readiness ensures safety and peace of mind for you and loved ones. Thank you for taking these vital steps toward better heart health and emergency readiness. Remember, education and regular training on recognizing heart attack signs and properly using nitroglycerin can empower you and your community to act decisively during emergencies. Encourage family members and caregivers to learn these life-saving techniques, and consult your healthcare provider regularly to review your treatment plan. By staying informed and prepared, you increase the chances of a positive outcome, turning a potentially fatal event into a survivable incident. Stay vigilant, stay safe.